Folks, I bet you do not know this shocking statistic. About 50% of children now have an insecure attachment style, and that is beyond epidemic levels. And most people have no idea this is happening. At the same time, about 20% of Americans now have a diagnosed mental illness. I believe these two things are linked, and I'm going to show you why. The psychology of attachment styles, which is how we connect with each other to share needs and feel safe, is deeply tied into mental health issues, but very few have made this connection yet. So I'm sounding the alarm in this video so you can see the shocking link between attachment styles and mental health issues. Because if you or someone you love is suffering, I would like to show you what you can do to fix it. I am Adam Lane Smith, the attachment specialist. I have 15 years of training and experience in psychology and relationships, including a master's degree in psychology and years in the field as a licensed psychotherapist. Now I coach and train people on the differences with attachment issues and how they relate directly into your problems in your life. Shout out really quick to my members who take care of me and support me. Thank you so much for the support that you bring. And all you new viewers who are just coming in for the first time, welcome, and I'm glad that you're here to learn about this. I know that many of my viewers, especially the female ones, are deeply concerned about mental health issues, especially taking care of their loved ones. You send me so many comments, and the people that you're trying to rescue from their pain, and it touches my heart. Thank you so much for being you. I made this video to help explain exactly what is hurting those people the most and how you can help, especially if you are a woman and can tap into that nurturing feminine energy that you bring to the world. Now, in this video, I'm going to reveal all through my lens as a trained mental health professional and now as the attachment specialist. So let's pull back the curtain and look at the harsh truth together about mental health and attachment styles. Let's go. So we're going to reveal this link about attachment styles and mental health issues going together, first by breaking down attachment, because you must know these things to see the clear picture of how mental health problems fit into this process. What is attachment? It's the way that we as little children connect to our caregivers, usually our parents, to give and receive love, to feel secure, to ask for things, to feel safe with them, to feel loved, to get approval and bond with them and feel relaxed in their presence. Sometimes this can be broken. You can grow up with secure attachment where your parents take care of your needs, you work together, they cooperate, they teach you, they guide, they're patient, they're loving, or you can have attachment issues where you grow up believing there's something wrong with you that makes other people push you away and not want you. This can create anxious attachment style, the belief that you are unworthy of love, so you have to earn approval from other people. It makes you powerfully codependent, where you look for people with problems and try to fulfill their needs so they won't abandon you. There's also avoidant attachment style, the belief that other people will never be fair with you. So you have to keep them at arm's distance and avoid every conflict and every intimacy because you can't trust others. Then there's an even more complicated blend of the two called anxious avoidant, what I call disorganized style. It's also called fearful avoidant. This chaotic blend with the chaotic name is push and pull, hot and cold, can't make up their mind about what they want to do because they're afraid of connecting and also afraid of losing out and being abandoned at the same time. They push, they pull, they run, they jump back in. They don't know what to do. It can break and it can stay broken until you fix it. Now, there's 5 brain chemicals to understand how this impacts. 5 brain chemicals you need to know about that change with attachment issues, okay? Oxytocin is a bonding hormone released when you feel relaxed and safe, right? If you don't have very good attachment, you will not get much oxytocin or much connection. GABA, gamma-aminobutyric acid, is released as an inhibitory neurotransmitter. It shuts down the expressions of cortisol, the length of it. It makes you feel safer, less anxious, less depressed. As you have higher oxytocin, feeling relaxed and safe and warm and accepted, you then release more GABA. It also releases melatonin to help you sleep at night. Those two are directly related to attachment. And if you have really bad attachment, you don't have much of those. There's also vasopressin, a hormone released when you solve problems with other people. When you have secure attachment, you can open up and say, hey, there's a problem. I need some help. Solve it. Boom, you get vasopressin. If you don't, if you're afraid that solving problems together is impossible or that no one will care about you, you'll also be lacking that. Serotonin is a very, very special neurotransmitter. It helps you feel good. It helps you feel happy. It elevates your mood. It makes you feel long-term stable and emotionally loved and cared for and all of these good things, right? You can get some through exercise, through sunlight, through good food. And this is why a lot of people who are miserable with bad relationships obsess over self-care. But a lot of it's supposed to come through your relationships. And number 5 is dopamine. It's a short-term sugar high. In fact, sugar gets you a lot of dopamine. A lot of temptation behaviors and addictions give you dopamine. Now, when you have attachment issues, you have this. This is what your brain looks like on bad attachment. This is what people live with. This is how people suffer. You have dopamine to try to be motivated, to try to stay safe, to try to be connected. You have dopamine, low oxytocin, low GABA. You feel unloved. You feel unsafe. You don't sleep well at night. You can't fight off anxiety or depression. You have low vasopressin. It feels like no one will ever solve problems with you ever. And in fact, you feel pretty helpless to solve problems. You have low serotonin, which is linked directly into depression and despair and hopelessness and suicidal thoughts. But you have dopamine. You can binge on dopamine. This is why most people with bad attachment end up anxious and depressed and addicted to all kinds of things. Pornography, chief among them. Sugar, also, caffeine, just to try to get a little motivation for the day. Now, this impacts you in childhood, and you grow up this way, looking like this, into adulthood and your relationships. That's all you know. It feels horrible to go through this process in this life. You doubt everything and everyone, even yourself. This is no way to live. And this is what attachment causes in your brain chemistry, people. Now, how do you live with attachment issues? Well, when you grow up believing you don't deserve to be loved or that no one will love you, you have performance anxiety about everything. Your brain looks like that, but you're anxious and stressed all the time. You have social anxiety. Perfectionism. You try to be perfect on everything, and if you're not safe. So you isolate from other people. You stay away from them. You feel lonely, even when you're with people, even when you're with friends, people you call friends. And you're obsessed with getting safe. Everything becomes about safety. Attachment issues create an awful reality that creates huge, huge mental distress and constant pressure. This can lead to terrible symptoms of stress. And your brain can crumble into despair or become hypervigilant or try to escape. Now, to be clear for this next portion, I'm going to lead right into diagnoses and issues that I saw as a licensed psychotherapist. And I want to be really clear about something. I'm not attempting to diagnose or propose specific treatments for mental health disorders. This is not to be taken as medical advice. Okay? Consult a licensed professional for diagnosing and treatment of recognized disorders. But when you do that, talk to them about these possibilities. Gather information and then go talk to them. So let's talk next about how I see mental health diagnoses fitting into this attachment mess, because I worked for years in this field with some very specific people that opened my eyes to some things that you need to know. Right off the bat, let's talk about one of the most common mental health problems that are diagnosed: generalized anxiety disorder. I have general anxiety about most things in my life, and I am always nervous, and it's easy to become nervous, and I just feel worried all the time chronically. I have poor sleep and poor eating habits, and I give in to impulses a lot to try to feel better, and I'm just always kind of worried. Okay. Doesn't that sound a lot like this? Doesn't that sound a lot like low oxytocin, low GABA, low vasopressin, low serotonin, trying to just binge on dopamine? Doesn't generalized anxiety disorder sound a lot like attachment issues? Doesn't the research show that about 50% of children now have attachment challenges? Insecure attachment? 50%? One in two? Flip a coin? Sounds like this could be caused by that. Teenage depression and adult depression. Okay? Let's talk about that. I feel deeply unhappy. I lack pleasure in my life. I feel unsafe. I feel helpless. I feel hopeless. I sleep most of the time because my life is just so bad. I feel like I'm never going to get better. I have a depressed mood most of the day and most times of the day. I have a hard time feeling any motivation. I don't enjoy most things. And I just really struggle to have any kind of motivation or energy in my life. Doesn't that sound like this? Taken to a degree where trying to be safe is no longer possible and you've given up on being safe, so now you've just crumbled? I think that this is where a lot of teenage depression comes from. I don't think that teenagers becoming so crushingly suicidally depressed that they want to take their own lives in mass quantities across our entire culture. I don't think that's biologically normal. Do you? Leave me a comment. Please let me know. I would love to hear if you think that is biologically normal or if there's something wrong here. Let's talk about post-traumatic stress disorder. This was one of my real specialties as a clinician. Attachment and PTSD actually went together. I diagnosed a lot of PTSD in severe cases, and I was quite an expert in it. Let's talk about PTSD. Something horrible happens to you, right? This is what EMDR, eye movement desensitization reprogramming, EMDR certified therapists will teach you something of what I'm about to teach you. Your brain starts trying to form two answers to two questions. What are all the variables that went into what happened to make me feel so unsafe and so hurt? And how do I make sure I never get that hurt again? But those are logical brain questions. And when you touch an emotional memory, your emotional brain spikes, your logical brain diminishes. And there's a reason that there's specific therapies for this. But when the answer is, nobody will ever help me, I'm completely alone. Bad things happen to me, and I've tried as hard as I can my whole life never to do an unsafe thing, but I keep getting hurt. And now there's nothing I can do, and I feel hopeless. I don't know why people are hurting me. I don't know why people don't care about me. How are you going to answer that question in a way that doesn't just circle over and over and over and over in your brain? Which is what PTSD is, by the way, reliving it endlessly as your brain tries to process it. Do you think PTSD could be related to attachment? Maybe not caused by it, but if you have attachment issues, is it possible that it is exceedingly more likely for you to develop post-traumatic stress disorder where you can't move past it because you can't get those answers? Let's talk about panic attacks. I worked with a tremendous number of panic attacks. I still do. In my coaching, I don't treat panic disorder, but people come in with all kinds of anxiety issues and panic challenges. Panic attacks are your system being so anxious all the time that you are now redlining. And you have no buffering room to go when something actually bad happens. So you start panicking because you don't know how you're going to get safe. You start panicking in non-life-threatening circumstances. You're redlining from constantly being afraid all the time. Well, doesn't that sound like this? Taken to a high level during an intensely stressful situation, wouldn't you freak out and go way up through the roof on your emotional brain? This is why fixing attachment issues seems to start fixing anxiety issues and panic issues. Let's talk about a really hard one, you guys. Bipolar disorder and attachment, right? Bipolar disorder. Oh, no. That's purely chemical. We don't know why it happens, but their brain was made wrong, so they just need medication for life. Well, interesting. Interesting that people seem to believe that. I worked with a doctor. I worked with a very educated medical doctor who worked with underage youth who had manic episodes and shouldn't technically be diagnosed fully at that point yet with bipolar disorder, but they had manic episodes. And their parents would push, give me the diagnosis, give me the diagnosis. They can get things out from school. They can get special help. And I remember working with him in some of my formative years as a therapist. I remember working with him, and he said, Adam, see this 17-year-old girl here that you're shadowing me with? Yeah. I refused to diagnose her. I was fresh out of school, and I said, why? He said, because at 17, I still believe this is a behavior issue and a connection issue. He didn't quite know the word attachment, but a behavior issue and a family issue. Let's see what happens. He pushed for family therapy. It just so happened that that was my specialty. I was a licensed marriage and family therapist, fresh out of school, fresh in a licensure process. I was almost licensed. And he worked with us to build their family back up. As they came to understand her, all of a sudden her manic episodes weren't important anymore in her brain because she didn't need them. Here's something interesting that how I see bipolar and how this doctor saw bipolar. If you are so stressed out all the time and being perfect, and you know you never will be, and you feel like no one will ever love you, and if you slip up even a little, everyone will destroy you. At some point, your brain starts to go into extreme burnout mode and starts to redline. Some people have seizures at that point. But what if a process evolved to not have seizures by releasing different chemicals in the brain that turn off maybe the prefrontal cortex, which is the judgment center of the brain that stops you from acting, because maybe it's overdeveloped in some people, to keep them safe for whatever reason in their relationships. Attachment. What if there was a process to turn that off for a while so they could experience pleasure and joy without the worrying about judgment for a few days? And then what if they came back online and they were so horrified by the stress release that it sent them into depression? What if their family instead dropped that perfectionism and helped them feel loved and safe and accepted, so their brain did this? And all those chemicals and neurotransmitters came back. What would happen? Well, in the case of this doctor and this child, the 17-year-old young woman, with the family work, as her family embraced her and they fixed their attachment and they loved each other and cared for each other, as I guided them through this and he guided them through it, all of her issues went away. Suddenly she didn't have manic episodes anymore for a few months, then a year, then 2 years. Suddenly her brain didn't have a reason to. It was fascinating. I present that evidence to you to think about. Psychosis. Schizophrenia. Let's take a really hard one. Schizophrenia. Just random problems. Boom, you got hit. You got shot with a schizophrenia gun. There's no hope ever. It's just pointless. Let's just put you in a home and give you medication because you are useless for the rest of your life. This is what they say. This is what they essentially teach to people with schizophrenia. It's not true. I don't advocate for that at all, but this is what they teach. There was an interesting study over in the Nordic countries on this years back, where they refused to medicate people with schizophrenia. Instead, they brought them and their families into treatment centers and gave them extensive, thorough family therapy. One could say fixing attachment issues. No medication. And what they found was that after those months of work and connection and a good attachment, the families that took to it, the person with the schizophrenic challenges, all of a sudden they experienced very, very few of them. And they were very, very weak episodes if they did have them. And they never required hospitalization again because their family came around them, guided them, loved them, and brought them back. It was fascinating. It was far, far, far more effective than any medication ever has been by fixing attachment. One last thing here, guys. Personality disorders. Some of those fearful things we fear of people. Sociopaths, antisocial personality disorder. Borderline personality disorder, very chaotic in relationships. Well, this ties directly into attachment. Directly. Because personality disorders are the extreme version of attachment issues. Let me be clear. In school, in graduate schools, and I've talked to other mental health professionals to see if they got this training too. Most mental health professionals with a master's degree in psychology or a PhD, a doctorate, or anything, are told attachment theory doesn't matter because there's no diagnoses really for it unless you work for children who are like 4 or 5 years old. And if you don't, you just want to work with adults, you only have to learn personality disorders because that's what attachment issues become if it's bad enough and it leads into adulthood. Don't worry about attachment theory unless it's personality disorders. But guys, what if this is the problem? What if this brain chemistry from attachment issues could go like this? I believe that attachment issues and mental health issues go hand in hand, and that they always have. I have always hated this answer, though, from the medical system. We don't understand how chemical imbalances happen. We just medicate them, and people just need those meds, and then they can go to talk therapy and talk about the issues that arise from that so they don't feel so bad about their issue. I believe that's a weak answer from a system that doesn't make this connection because they're taught attachment theory doesn't matter. So now you have made the connection with me, and you and I understand this together. Here's what you're going to do about it. All of this ties back into attachment issues. Attachment issues, one more time, are the way we connect to other people in childhood to get and receive love, to share needs and expectations, to feel safe, and to feel connected with others. And when that breaks, we don't know how to get our needs met and feel safe and feel connected. So we have to try to guess, either by making other people happy so they don't abandon us, or appeasing other people but keeping them right here so they can't get close enough to hurt us. All of this ties back to attachment issues. So if we fix attachment issues with the brain, I believe it fixes all those mental health issues downstream. I wrote my book, Slaying Your Fear, as a primer for my clients when I was a therapist. And I'd say, you have these diagnoses, but here's what I believe is underpinning it. Read this book, decide for yourself. And if you would like, we can include what's included in Slaying Your Fear, a process to fix attachment, in our treatment plan here for your other diagnoses. Brief process for fixing it. You fix authenticity within yourself by defining your core values and who you are and what you want to live by, the decisions you want to make. Then you build authenticity with other people by talking to them and asking them what they expect and telling them what you expect and giving that so that relationships make sense and they're clear and they're easily understood so that you can build that connection with them and get your needs met without playing games. Then you build authenticity in romantic relationships as well, so that dating is not so confusing or scary or fake, and you build secure, stable, loving relationships with friends, family, partner, and self. That's how you fix the attachment issues. I recommend everybody watching this fix your attachment issues if you have any. If this is resonating, if the brain feels like this, fix your attachment issues. It gives you a much greater chance of inviting other people into a loving relationship that will feel better and help them be better. And if you're watching this and you feel like it's too late, my oldest client was a 79-year-old woman. She came in with horribly broken attachment, lifetime of abuse, of misery. She had kids, she had grandkids, she even had one great-grandchild. 79 years old with a terminal illness. Adam, is it too late? No. Let's do this. I told her, and we did. She fixed her attachment issues. Took her a couple months. She fixed them. She was driven. Then she fixed them with her daughters. Then she fixed them with her grandchildren. Suddenly her family line was healthier. Her whole family was healthier. She took those steps and built great connections. And she fixed her family and healed them at 79 years old. Created a better legacy for herself and a better future for her whole family because she came and learned attachment. Her brain did this, and then she could give that to others. That's my step. That's my encouragement to you. Take those steps. Take those steps and fix your attachment to build deeper connections that boost those brain chemicals we learned about. You need to feel connected to others and accepted and bonded and loved for GABA and oxytocin. You need to be solving problems with other people. You need to be having deeper conversations that really fulfill you and where you feel seen and heard and understood to get those brain chemicals going. Then dopamine's not as necessary. You don't worry about that. Women here watching, I have a special place in my heart for you because feminine energy comes in here big time. Feminine energy is about inviting, nurturing, bringing hope and comforting. That's why mom is the first person that gives us oxytocin and GABA. Mom gives us a ton of these. And when mom and our relationship with her is broken, that breaks very, very easily, all too easily. Feminine energy is all about giving people this brain chemistry right here. This is the power of feminine energy, is to make other brains do this. That's feminine energy, and that's the power you have. Female communication, for example, very clear in bonding and in needs and in sharing and in connecting and in honoring each other and in making each other feel loved. Asking questions so people feel like someone's interested in them, right? It helps bring relief to people who are suffering, that somebody cares about you and is interested in you. I had a client story about a woman who came in worried about her brother. And she had no idea how to help him because he was so depressed and he felt so alone and she was so afraid of what he would do. So I guided her in a couple of coaching sessions to how to give him love and how to talk with him and how to nurture him through that feminine energy to help first get her brain better and then help his brain start to go like this. Now, she couldn't do it against his will, but thank goodness he was open to it and his brain started doing this. And their bond, when they did that, he bonded to her so completely and his whole life got better and he became such a stronger man because of that feminine energy. That's the power that you have. And I greatly encourage you to use it in this world. Now, the best way to do this is by having secure attachment interactions with other people. Open communication about needs, clarity about expectations, right? Being able to tell people how you really feel, what you really want, cooperating during conflicts to solve problems, resolving issues quickly together without blaming, without anger, but solving problems by finding solutions together, right? This boosts oxytocin, boosts GABA, boosts vasopressin, boosts serotonin. If you want a deeper dive into this, on how to fix this, the Attachment Bootcamp video course goes into great depth on building an authentic relationship with yourself and with others and in romance. So if you want that brain chemistry that goes like this through your relationships, I recommend you check out the Attachment Bootcamp video course. I poured my 15 years of training and experience into that course. So if you right now are resonating with these connections that took me 15 years to put together, now you have some of those pieces too. I recommend that you do something about it. Don't just watch this video and move on and say, oh, that's nice, I'm going to go watch puppies next. Do something about this, because attachment issues, they can be fixed. And not just fixed from bad to okay, but boosted so that your attachment is great and fulfilling and your relationships are better, so much better. You can keep improving your attachment and your bonds with other people and with your loved ones who are hurting. Love and authentic connection are the best psych medicine that there is. I believe that with all of my heart. And I hope that after watching this video, you believe it too. So if you know someone with an issue, here's a step you could take. Share this video. Start working together on your connection. Build the bond that both of you need to feel secure and relaxed in your connection. You have this power now. The world needs your feminine energy, especially feminine energy, to heal all of us. You can be that positive change in the world that so many of us are looking for. So please leave a comment with any questions that you have about this topic. I'm going to see the comments and I will answer. Until then, until we have that conversation, thank you for being here. I am Adam Lane Smith, the attachment specialist. For more information on environment affecting your mental health, I recommend the next video that you watch is my video, OnlyFans and the Collapse of Modern Society. You're going to see some ugly truths in there, but it's going to bring a lot of clarity to you. I will see you in that video.